Again, on a personal level, when I came to this country in 1966, the entire Bay Area,
Hmm.
Indian population was 1,000 people or less.
Wow. Right.
But then came big change in US immigration laws with Kennedy Johnson in 64, 65 that allowed highly qualified people to enter this country easily with, especially for education. That's what actually brought me here. Upesh, when something contrasting happens,
Hmm.
sometimes wakes you up. So in my case, when my company VERSATA first went public, there were very few companies of Indian origin that had reached that point. So if I remember back, I was a celebrity at that time.
Hmm.
Fortune magazines and local magazines everywhere, right? They were talking about this. But when I come back home and can't walk properly,
Hmm.
can't enjoy my food, was giving me thought, what is it for?
Hmm.
Mr. Bakshi, would you like your kids and your spouse to see you in nursing home, or can you become a health hero?
Hmm.
I would start by saying that the key numbers are that your parameters
Hmm.
improve and you become fit. Fit
Hmm.
means your sugar levels are in control below diabetic levels.
Hmm.
Your cholesterol is below low. Your triglyceride is low. Your heart abilities have gone up.
Hmm.
All of that improved. But as a result of all that, I also lost 90 pounds.
Wow.
Meaning of CWC is very, very important.
Okay.
So what we are saying is crack your wellness code. Each one of us are very different. We have a lot of commonalities, but what works for Upesh may not work for me. So
Right.
we all have to crack our own wellness code with help, with guidance, with guidelines.
Hmm.
Uh, exact food that you're eating, Upesh, today may not work at all with your wife.
Hmm.
I know it doesn't work. Same thing for my wife and me.
Hmm.
And what food worked for you at age 50 may not be the exact same food that will work for you at age 80. So
Right.
health is a journey, not a destination. So
Right.
we have to say, let's continuously take health in our hands
Hmm.
and keep on listening to our body and making adjustments as you move. So CWC's mission is just that, is to create a community
Hmm.
both through hybrid means locally as well as internationally to help each other, motivate each other, bring members together in events, programs which are educational, inspirational by health heroes like myself and many others. People who have learned to learn continuously,
Hmm.
have a curiosity, who are willing to change directions,
Wind up
do
our
better.
talk. Looking back at your life, if you were to give advice to a young person in their 20s and 30s, what would it be and why? Hi, viewers. My name is Upesh Jain, and greetings from the San Francisco Bay Area. I'm the host of the Exec Talk channel, a forum I started to talk to CEOs, executives, and other luminaries about their journeys and distill their experiences and learnings for our viewers' benefit. It gives me great pleasure to introduce Naren Bakshi, who has been a chairman, corporate executive, serial entrepreneur, community leader, health hero, and speaker. Currently, Naren is leading a global wellness movement, Crack the Wellness Code, around the globe. He is an inspiring health hero who has demonstrated that with lifestyle changes, one can, at any age, reverse chronic diseases. He lost 90 pounds and got rid of all ailments, including diabetes, sleep apnea, and hiatal hernia, at age 65 and has maintained an active lifestyle throughout all these years. Mr. Bakshi has an unquenchable thirst for learning, knowledge, and personal improvement. His quest to improve his health has made him an advocate for healthy living. He gives invited talks on his remarkable journey of personal health transformation. Professionally, Naren Bakshi is a serial entrepreneur and mentor to founders and for social impact initiatives in healthcare, wellness, education, internet, and e-commerce. Founder of TiE Rajasthan and charter member emeritus of Silicon Valley, founding trustee board member of India Community Center, he has a master's degree in engineering and an MBA from the University of California at Berkeley and a BS from BITS in Ranchi in India. He has lived in the US for the last 55 years and maintains a home in Silicon Valley. He understands the US as well as India from spending 4 months every year in India since 2000. He was a member of the White House delegation during President Obama's visit to India and part of the TiE delegation to Indian Prime Minister Vajpayee in 2000. He's the founder and chairman of several companies, including VERSATA, which he built into a $2 billion NASDAQ-traded company. He's an inspiration to the community as well, and I have looked upon him for quite a few years. It is truly my pleasure to welcome Naren, and I'm really excited about our conversation going forward.
Pesh, I've known you for a number of years, and thank you very much for this very, very generous introduction. In reality, I can summarize everything you have said in just few sentences. Basically, I must say that I was very blessed to have been born in a family that value education. I got good education in India, and luckily at University of California also. But then luck have it, I was a mechanical engineer, but computers were just starting. So I got into the computer field, management sciences, data sciences, in nascent state. Almost nothing existed. That made me gave me opportunities to work with three major corporations in Midwest, all the way from an oil company to a banking company to a space and defense company, and that finally led to my opportunity to come back to Silicon Valley and start entrepreneurial journey when in 90s it was not common. So I got lucky that I came back here at the right time, and there opportunity to get involved in TiE in the first conference. Me one of those lucky opportunities to get funded very quickly because people were looking for something new. And then even more important than that, after having done whatever I needed to do, I got an opportunity to work with top people around the globe in giving back.
Right.
By the way, it is also a blessing to have an opportunity at the right institutions to give back. We all are trying to give back, but your impact is high if you're working with other good people. So it was TiE, then ICC, now more importantly, my most difficult mandate, CWC.
Yeah, you're absolutely right. Giving back is huge. And at a certain point in your life, you realize how important that is. In fact, I started this channel as a means of giving back to the community by kind of funneling the information from people like you and then disseminating it to my viewers. So that's a key point that you make there. So Naren, this is a phenomenal journey, and it's too long to recap everything here. But I wanted to know about your early journey growing up in India and then making the move to US in the 60s. So it was a different time from what we know, and what changes do you see between the US of then and the US of now, both personally and professionally?
So let me start on a personal level first.
Mm-hmm.
Clearly, as I mentioned to you, I got good education, and immigration in 60s, early 60s was very hard.
Right.
But then came big change in US immigration laws with Kennedy Johnson in 64, 65 that allowed highly qualified people to enter this country easily with, especially for education. That's what actually brought me here.
I see.
We didn't hardly know anything about institutions of US learning in India. Knowledge was very rare. No internet, no communication vehicles. It took 3 weeks to send a letter. So it was a very different world. But having come here, what I noticed first, and it reminds me of what's going on today, was I entered Berkeley, and Berkeley was full of demonstrations. The demonstration happened to be about Vietnam War.
Mm-hmm.
And you hear today demonstration happening because of Palestine.
Mm-hmm.
So that part I remember again when I see what's going on today. Last year I went to Vietnam and I saw what happened there and what changed.
Mm-hmm.
So that was the environment that we were in. Again, on a personal level, when I came to this country in 1966, the entire Bay Area,
Mm-hmm.
Indian population was 1,000 people or less.
Wow. Mm-hmm.
Now, today, as we all know, not just Indians, but immigrants are very large numbers.
Mm-hmm.
We have 500,000 Indians in.
Mm-hmm.
So it's a major, major change. We came here as techies, but now you can see that Indians have performed in management roles, CEO roles,
Mm-hmm.
entrepreneurial community CEOs, and even venture capital
Mm-hmm.
and big corporations. So it has changed a lot on a personal level.
Okay.
Moving forward, our next two generations that I can see today, at my age 80,
Mm-hmm.
have broadened now. They want to go in journalism. They want to go in politics. So the impact that we will see
Mm-hmm.
next 40 years will be bigger.
Mm-hmm. And liberal arts as well, right?
And liberal arts. Now, on a country basis,
Mm-hmm.
one of the major change that has happened, perhaps not for as good.
Mm-hmm.
I came here in 60s, late 60s, 70s.
Mm-hmm.
Country was known for very high quality infrastructure around the world.
Mm-hmm.
Country was, I mean, we were seeing wonders like Bay Bridge,
Mm-hmm.
like Golden Gate Bridge, and all kinds of beautiful highways everywhere, and an education system that was wonderful for 80-90% people.
Mm-hmm.
Hardly anybody thought of sending their kids to private schools.
Right.
80% of the population was considered middle class,
Mm-hmm.
maybe 5-10% poor, another 5-10% upper class, but there was a big 80% that really dictated. What we see today is, as a country, our GDP is high,
Mm-hmm.
doing very well. There is no problem in that sense. But when you look at the total country situation, it is high degree of inequality, homelessness. So the
Mm-hmm.
problems have compounded in that sense.
Right.
Came here, there was no polarization.
Mm-hmm.
Democrats will work with Republicans, Republicans will work with Democrats. So it
Mm-hmm.
was a very, very enjoyable democratic country. But what we are seeing today, of course, is a lot of polarization. So things have changed in a very good way, but also very difficult way.
Okay. Okay. So I'll shift gears a little bit. So if you look within yourself, what are the key traits you think you possess that led you to embark on an entrepreneurial journey, form companies, sell companies, invest in companies? And what motivated you then? and what keeps you going today?
So, number one thing about life is about change.
Mhm.
World changes every year, every decade. So people who have learned to learn continuously,
Mhm.
have a curiosity, who are willing to change directions, do better.
Right.
So I have been lucky to be able to do that. It's like from mechanical engineering to industrial engineering to computers, right? That was major shifts. Then because of
Definitely.
MBA, went to management.
Mhm.
So the idea that you have to continuously learn, which is Upesh, a lot more possible today
Of
because
course.
so much information is available on the internet and Coursera's, and it's a continuous thing. But what I see is some people reach 50s,
Mhm.
what they learned in the college and other places is no more, and
Mhm.
they're not able to shift.
Right.
You're not able to shift, the life gets hard. And that the same thing is true of blue collar, meaning people who upgraded themselves to
Mhm.
learn new skills with the robotics and other things, they are doing very well.
Mhm.
People who are not able to or not willing to are not doing well. So first trait really that I got really probably from my father
Mhm.
was very curious. He wanted to learn this, learn this, learn this.
Right.
He became, he first learned sciences, then he did LLB, then he went and did doctors in naturopathy.
Mhm.
So that kind of a feeling allowed me to continuously learn.
Mhm.
Same thing is true of what do you do.
Mhm.
So when I started, of course, I had to seek jobs, to apply. Somebody has to accept you. Somebody gives you a job. Somebody else thinks that, oh, he's taking away my job. But then to reach a point where I could create company that gave jobs to others,
Right.
very, very inspiring.
Different ball game. Yeah.
So that's really so coming back to this ability to change,
Mhm.
ability to learn from younger people.
Mhm.
Like you, Upesh, it is absolutely true. I have five grandkids,
Mhm.
broad age.
Mhm.
So every year I make a request. Uh, they will call it demand
Mhm.
to my grandkids. You must come and spend a day or two with me and teach me something new.
That's great. Yeah.
So the idea that I can learn from my grandkids and my kids. By the way, this is again maybe different than others.
Mhm.
I actually enjoy more with younger people than my own age group people,
Mhm. Fantastic.
mainly because some of them have just lived in the past.
Right. Yeah. So, I couldn't help but think of this analogy while you were talking, right? That water that stagnates, that remains still, stagnates, and water that keeps flowing actually becomes a river or a force. So I see that similarity in what you were saying. So in 2000, by that time you had accomplished a lot professionally, been there, done that. In 2000, you had this realization that your health was kind of not at its prime or it was going south, and that you needed to do something about it. Can you tell us something about that? And how did you embark on that personal transformation journey?
Upesh, when something contrasting happens,
Mm-hmm.
sometimes wakes you up. So in my case, when my company VERSATA first went public, there were very few companies of Indian origin that had reached that point. So if I remember back, I was a celebrity at that time.
Mm-hmm.
Fortune magazines and local magazines everywhere, right? They were talking about this. But when I come back home and can't walk properly,
Mm-hmm.
can't enjoy my food, was giving me thought, what is it for?
Yeah.
What have we done? And
What
then
is
I
this for?
started to go, when I started to go back to India,
Mm-hmm.
see my father in great health. He will tell me, Upesh, he will tell me, Naren, we have given you good genes, me and my wife.
Mm-hmm.
So whatever has happened to you must be because of your own doing, meaning your own lifestyle.
Right.
So do something about it. Unfortunately, at that time, I'm talking about 2000 to 2010, there were no programs available. There was no data available as to what to do, how to do. So I had to start experimenting just like you will experiment as a entrepreneur.
Mm-hmm.
But my goal is to become healthy. So I
Right.
started that journey, recruited my best team I could from my medical doctors. I found a health coach named Sham Das.
Mm-hmm.
I found a diet a specialist believer in Mr. Godwani. And, and I worked with them for 18 months. And during this journey, what I realized was every 3 months when I go back to my doctors, things started to improve.
Mm-hmm.
And they start, and by the way, I asked them, requested them, and they at Kaiser do it anyways. You're keeping my records.
Mm-hmm.
Every quarter, they say, oh, Mr. Bakshi, your A1C is much better than before.
Right.
Maybe you should reduce medicine. And if they didn't, I asked them, should I reduce? First, they will hesitate, but they then said, let's try. And if there's a problem, I'll come back. So over this 18 months, Upesh, I reversed, not managed. See, the word that we have to learn is it's one thing to manage
Mm-hmm.
a problem that you have, which is important. But if you can reverse at that age, you really feel much better.
Right.
Was able to climb the big Mission Peak
Mm-hmm.
right next to my house with
Right.
no trouble. My heart became healthy. Doctors started to say, Mr. Bakshi, your pulse is low.
Mm-hmm.
And I think it is because you have athletic heart.
Mm-hmm.
My
So,
calcium
but
started.
I'm curious to know, after you had the realization, after you used to come home and not feel good, what were those baby steps that you took? And what kind of energy or force behind your thinking kind of catapulted you into taking those steps, right? It's the realization a lot of people have, but actually getting off the couch and doing it is a totally different ballgame.
So first of all, I tried what was available, like Weight Watchers and all these
Hmm.
things.
Hmm.
And what I realized was they were yo-yos.
Hmm.
You work hard and then try for 1 month, 2 months, you drop weight and then comes back.
Hmm.
So I realized that is not working. That won't work, right?
Right.
But what your point is very important.
Yeah.
What was the reason I was willing to put my best, just like creating a company,
Hmm.
make it a project?
Right.
And it was really a question that my good friend Godwani asked me one day,
Hmm.
Mr. Bakshi, would you like your kids and your spouse to see you in nursing home, or can you become a health hero?
Right.
That's the words.
Hmm.
I said, I want to be second.
Hmm.
So I really, really changed all my thinking. And I said, number one goal for me is to improve my health. So Pesh, what happens is if you are very clear
Hmm.
your goal and why do you want to do it,
Absolutely.
then the motivation keeps on going.
Yeah.
Yes, right? So
And I think once you do embark on that journey, the small feedback that comes your way in terms of improvements and feeling good propel you further to keep going, in your case, right? Because you started this in your late 60s, which
yes.
is you know not an easy task. So that's really creditable.
So Pesh, let me tell you what helps.
Uh-huh.
and it requires courage, is like if you set a goal as a corporation and
Mm-hmm.
make it public that we are going to do this next quarter or next year,
Mm-hmm.
and there's more pressure on you to
Yeah.
get it. So in my case, I decided
Mm-hmm.
to open my medical records
Mm-hmm.
publicly
Wow.
to my children.
Mm-hmm.
Every quarter, I would write them a report. This was my goal. I achieved 80% of it.
I see.
Okay. So,
Mm-hmm.
so what happens is, but the opposite happens. Oh, Daddy, you did 80%? That's wonderful. So you
Yeah.
get a positive reinforcement from friends and family, and it keeps on going.
Right. So, can you share with us some of the key metrics, key numbers, before and after that um, you accomplished, if it's okay?
Yes, yes. So first of all, you ask numbers.
Mm-hmm.
I would start by saying that the key numbers are that your parameters
Mm-hmm.
improve and you become fit.
Mm-hmm.
Fit means your sugar levels are in control below diabetic levels.
Mm-hmm.
Your cholesterol is below low. Your triglyceride is low. Your heart abilities have gone up.
Mm-hmm.
All of that improved. But as a result of all that, I also lost 90 pounds.
Wow.
So one of the key things that I've learned is please don't make a goal of losing weight.
Mm-hmm.
Please make a goal of becoming fit.
Mm-hmm.
As you become fit, weight will come down as a result, right? So
Absolutely.
that was one thing. Uh, the the second thing is you have to say, why am I doing it is for my happiness. I'm not doing for anybody else. I want to be happy.
Right.
Now, for your happiness, health, mind and body health, both
Mm-hmm.
are important.
Right.
So uh, that's really what propelled it. My doctors tell me that I have developed new arteries.
Mm-hmm.
The old arteries may still be blocked, may have calcium.
Mm-hmm.
I'm okay.
Mm-hmm.
So at age 80, I can go to India for 4 months. I can next week I'm traveling to Boston to attend my grandkids' graduation party.
Mm-hmm.
So I'm able to do things that are enjoying and giving back.
Right.
That's what
Right.
was a positive thing.
That's
So
about, yeah.
so let me also give you a sense of what are the few things
Mm-hmm.
that really are required if you think it's the right thing to do.
Sure.
So
Absolutely.
so people say in different ways, right? Some people use the words meds, somebody says medals. So
Mm-hmm.
let me just use the medals as one of the acronyms.
Mm-hmm.
First thing is mind is more important than body, which
Right.
means anything you can do that will calm you down, reduce your stress
Mm-hmm.
is important. What is there? It's clearly meditation, it is sleep,
Mm-hmm.
it is mindfulness.
Mm-hmm.
So, whatever you're doing, if you can focus on it, that is number one because sleep is the one time when your body recovers.
Right.
So
So
right time,
perhaps we can say it's mental health also. These three things impact your mind or mental health. Right.
your stress level goes down.
Right.
Right now, the biggest problem in the valley that I see,
Mm-hmm.
at least in the community that I am in,
Mm-hmm.
is the stress. And sometimes people don't even realize how bad that stress is.
Mm-hmm.
Second thing required is exercise.
Mm-hmm.
Now, people get confused. Exercise has several dimensions. Clearly, you need to increase your oxygen intake,
Mm-hmm.
which means cardio.
Right.
Like you can do it by bicycling, running, walking, whichever way you want to do it. You need to create flexibility, which means things like yoga.
Mm-hmm.
You need to increase, build your strength, resistance training, right? So all these combination of things, it doesn't matter which method you use.
Mm-hmm.
There's so many studios. It doesn't matter what.
Mm-hmm.
doesn't matter what kind of meditation, you must do these two. The third one, we have to make it simple. That is diet. So calorie counting is very hard.
Mm-hmm.
Weighing everything is very hard. So you have to figure out what is the right thing. So first of all, the best food after a lot of research that is unquestionably accepted
Mm-hmm.
is the best food for any human being is plant-based,
Mm-hmm.
organic, seasonal,
Mm-hmm.
local, unprocessed.
Right.
So any food you look at, if it has any one of those characteristics, that's good for you. But what you have to also remember, what is it that you shouldn't eat or you
Mm-hmm.
should reduce? That would have SOS.
Okay.
Any reduction in salt, oil, and sugar
Mm-hmm.
is going to improve things. And then, of course, depending on your need, you adjust carbs and proteins. So it's as simple as that. But
Nice.
what's confusing, Upesh,
Yeah.
exact same food, exact same quantity. If you eat at 6 or 7 p.m. versus 10 p.m.,
Right.
there's a different impact. So it is not just what you eat, when you eat, and even how you eat.
Mm-hmm.
When I say how, you mean if you take few minutes quietly and eat with chewing properly, it
Mm-hmm.
has an impact. Then you pick a burger and running in the car and keep on gulping it, that has a different impact. And then most recently,
Mm-hmm.
also been discovered is periodic fasting
Mm-hmm.
good for you, and that's the where the word intermittent fasting has come. So that's about diet. Then fourth thing is about your own thinking process, your attitude,
Mm-hmm.
the idea of contentment, the idea of gratitude helps.
Right.
Love for yourself, your family, your friends, again improve things. And finally, you better be a human being, call it spiritual, call it ethical, call it whatever. So
Mm-hmm.
have any amount of money, if you can't sleep well because you're worried about going to jail, is not going to make you happy.
True.
That, so it's medals.
Yeah. It's another form of stress in some ways, right? If you're worrying. So that this is a good acronym and you know, fairly straightforward and simple. Uh, of course, putting it into practice is another challenge for most people, but yeah. So
I give a credit to Mr. Gopi Kalyal,
mhm,
the Google chief strategist,
mhm,
who went through a lot of difficulties, but he corrected itself and
mhm,
he came up with this medals word.
yeah. So also, I mean, things like this, you need a village to do them in some ways. So I'm sure you had a lot of people rooting for you and encouraging you in this process or advising you in this process that made you accomplish your goals.
You're right. And that is what caused us to create this institution
Okay.
called Crack Your Wellness Code,
Okay.
CWC.
Yeah.
Uh, a doctor who's our co-founder, Dr. Pankaj Vij, approached me
Mm-hmm.
from Pfizer,
Mm-hmm.
and he said, Mr. Bakshi, I would like to join hands with you
Mm-hmm.
to take this message to not few hundred, few thousand that I could do,
Mm-hmm.
few million people around the globe.
Mm-hmm.
So can you join hands? So I recruited another gentleman, Mr. Somnath Chatterjee. So three of us co-founded this institution first at ICC as
Mm-hmm.
an experiment, and then the last 2 years created CWC Global.
Mm-hmm.
Now, meaning of CWC is very, very important.
Okay.
So what we are saying is crack your wellness code. Each one of us are very different. We have a lot of commonalities, but what works for Upesh may not work for me. So
Right.
we all have to crack our own wellness code with help, with guidance, with guidelines.
Mm-hmm.
Uh, exact food that you're eating, Upesh, today may not work at all with your wife.
Mm-hmm.
I know it doesn't work. Same thing for my wife and me.
Mm-hmm.
And what food worked for you at age 50 may not be the exact same food that will work for you at age 80. So
Right.
health is a journey, not a destination. So
Right.
we have to say, let's continuously take health in our hands
Mm-hmm.
and keep on listening to our body and making adjustments as you move. So CWC's mission is just that, is to create a community
Mm-hmm.
both through hybrid means locally as well as internationally to help each other, motivate each other, bring members together in events, programs which are educational, inspirational by health heroes like myself and many others.
Mm-hmm.
By the way, we have thousands of them. So it's no more than Naren Bakshi alone. There are many, many examples of doctor health heroes. There are many examples of heart health heroes, cancer health heroes. There are people who have literally cured cancer without any surgery.
Mm-hmm.
Many, many examples. So that's the inspirational story. But
Mm-hmm.
finally, what works is support groups.
Right.
It's like Upesh, I know you have a great group of friends
Mm-hmm.
and, you meet with each other.
Right.
If you have common thinking, common goals, you will impact each other.
Yeah.
So the idea is if there are 20 people that have diabetic problem, if they meet once a week,
Mm-hmm.
some means
Mm-hmm.
they will improve their health much faster. So we created CWC Global in Silicon Valley headquarters.
All right.
We realized that we needed to take it globally,
Mm-hmm.
just like a TiE model.
Sure.
We created CWC India Foundation in India, which
Mm-hmm.
is doing a lot of good work in India now.
I see. So essentially, it's evangelizing the message and creating the awareness for people to improve their health and their lives by, showing them real examples of health heroes. And so it's a community of sorts, and um, you spread the word essentially. Um, are there any hospitals associated with this, or is it just a freelance uh, body that is kind of just spreading the awareness and evangelizing?
So we are in the business of prevention.
Mm-hmm.
We encourage early detection,
Mm-hmm.
inspiration, and support. What
Right.
we do not do
Mm-hmm.
is if you really need to get a surgery,
I see.
we you go to the right doctor at a hospital.
I
So we
see.
are not in the business of creating any infrastructure whatsoever
I
in
see.
terms of providing disease management.
I see.
If you
Okay.
have a serious disease, we recommend you to go to a best doctor. We have a very large number of physicians who are involved with this movement. We do have a marketplace,
Mm-hmm.
wellness marketplace,
Mm-hmm.
we are building, whereby good products and services, some of them are from businesses, are displayed.
I see.
So the idea is that we make it easier for you to
Mm-hmm.
pick and choose what would work for you and also get support from each other's as a membership model.
I see. So it's a one-stop shop of pretty much
Health
every.
and wellness.
Yeah. Awesome. It's such a noble cause, and good for the greater community, right? So wow. I mean, astounding accomplishment at this age as well, and a perfect example of giving back to the community. So, before we kind of wind up our talk, looking back at your life, if you were to give advice to a young person in their 20s and 30s, what would it be and why?
So my number one advice would be, please, as you are young, if you reach 20s, I hope you have gotten educated.
Mm-hmm.
If you didn't, it's never too late. Keep on getting education because it's a continuous journey.
Mm-hmm.
And our goal should be happiness, happiness throughout your life. Now, how do you achieve it?
Mm-hmm.
Is please make health a continuous number one priority. Number two priority, always, because we are social animals, is your friends and family. But don't ignore third, which is very, very important. If you don't have means, financial means to support yourself, you're not going to be happy. So
Right.
yes, work hard, create the wealth,
Mm-hmm.
make sure that you're taking care of your family and friends, but also then give back.
Mm-hmm.
Fact, that's one of the things I would like to leave with this. This movement, CWC, is dependent on, at the moment, on the generosity of patrons,
Mm-hmm.
board members, volunteers. So if any one of you get motivated and if you have some issues,
Mm-hmm.
you would love to help them, please contact me, join me, and Upesh, you can give them my name and number and
Yes.
phone number. So we'd love to support at the same time, seek help.
I'll put that information at the end of the interview. Yeah. Okay. Any other parting words of wisdom, Naren?
Now, my last thing I would like to say is I'm delighted that you are doing something yourself in
Thank
terms
you.
of giving the opportunity of people listening from many different walks of life. And hopefully, just like many other role models help me, maybe these role models will help others. So,
Absolutely.
congratulations for what you're doing.
Absolutely. Thank you. Uh, so, Naren, thanks for sharing your journey of your background, your personal transformation, and more importantly, thanks for taking time out for me and being so vulnerable about your life. So, on behalf of my viewers, I'd like to thank you so much for your time and your words of wisdom. Thanks. I really appreciate it.
Namaste and thank you.
Thank you very much.